Almost forgot. We are now live. Good morning, everyone. Thank you for joining us for the Committee on Education meeting this morning. I'd like to thank all the members who are present today for joining us, and to the members of the community who are here in the gallery, especially to give us public comments, and for all those who are watching online. Please allow me to introduce the members of the Committee on Education. Present today, we have our Vice Chair, Representative Sheila Babauta. To my right, Representative Danita Yangtamai. To my left, Representative Ralph Hummel. Absent today are Representative Ed Probst, he is excused, and Representative Donald Mangonia. We also want to thank the LB staff that are here to assist us with our meeting. Legal counsel is Joe Tyron. IT and streaming, we have John Diaz and Delbert Camacho. Our legislative assistant is Cameron Nicholas. And our sergeant at arms today, who's our sergeant at arms today? It's Toy. Okay, I believe it is Pete Toy today. We do have a quorum, so we will begin. This meeting is begun. All right, calling to order. I'd like to get a motion to adopt our agenda. So moved. All right, we have, it's moved. Do I get a second? It's seconded. All right, for all those in favor to adopt the agenda, please say aye. All those against say nay. The ayes have it, and the agenda is adopted. Next on the agenda is the adoption of minutes. I would like to clarify one thing. The meeting for February 16th was actually canceled, so the meeting minutes that are being adopted today are for the November 22nd meeting, I believe. You should have all received a copy of those minutes in previous emails. I hope that you've had a chance to review them. If you'd like to have a few more minutes to go over them. And when you're ready, if I could get a motion to adopt the minutes for November's meeting. So moved. Can I get a second? All right, meeting minutes. Okay, meeting minutes have been motioned and seconded. Can I get if you are, excuse me. If those are in favor, say aye. Aye. Those against say nay. The ayes have it. Motion to adopt the minutes is passed. Next up on our agenda is public comments. And so we do have several people in the gallery who are present today to give public comments. And so we will allow them to get set up and begin. I believe the public comment area for today is right outside the door. And if you can make sure you state your full name for the record, and please stay within 5 minutes. Thank you. Public comments are open.
Done.
And while we're setting up, I just wanted to clarify our Sergeant at Arms is Sergeant at Arms Santos.
This is their car. All right. Good morning, and thank you for this opportunity. My name is Ambrose Bennett. Believe it or not, I've been trying since 2007 to impress upon the powers that be the need for a systemic workforce transition plan. But it seems that some stakeholders are hesitant to commit to a single plan as they are doing their own individual thing. The apprenticeship programs are great, but many of the CW jobs do not require apprenticeship training, and there is no accountability. I am here today to ask this committee to take a real step forward and devise a system-wide plan by law that can be accountable for all the employers and CW jobs, whether these positions are filled or not, and all the students and adults in the private sector who can potentially replace a CW. If a plan had been implemented back in 2007, when I first introduced a viable plan, the federal mandate would have never even become a reality. But now there is a federal mandate, and the CNMI still doesn't have a workforce transition plans. Please, and I will reiterate, please know that know that the feds are not going to ask PSS, NMC, nor NMTI about the CNMI's transition of CWs, as they will ask the CNMI government to to date, our government does not have a plan. It is actually lackadaisical governing to not address the need for a system-wide plan. Making the assumption that PSS, NMC, NMTI are doing enough is a deadly mistake that will surely lead to the feds taking over our government's workforce transition. PSS, NMC, NMTI cannot lead nor be held responsible for what is supposed to be a system-wide transition by the CNMI government. It should be duly noted that the federal mandate requires that the transition of 500 CW jobs per year, and I'm sure the CNMI is not even coming close to meeting this number. We may be able to offer some rationalization for more time in 2029 due to the pandemic, but the bottom line is there is need to be a plan by the government. My efforts are not being fully respected and embraced by the stakeholders, which is why I am strongly recommending that this committee follow the advice given to me in a meeting at PSS by the previous BOE chair, who said to me, "Your idea is really great, but if you want to bring everyone together to transition our workforce, then get a law, and even then it still might be a challenge." A transition plan driven by a law is the CNMI's best hope for avoiding another federal takeover. We also know that we cannot do without the CWs, but the CNMI must justify keeping the CWs come 2029, which is something PSS, NMC, nor NMTI is doing, and neither is the government. We are setting the CNMI up for failure again when it can be avoided. In conclusion, I will say if we had learned anything by now, the CNMI should know the feds will come in and take over the transition, and their methodology surely won't be as friendly to the stakeholders as we can be to ourselves. I am just trying to give the CNMI a research-based, tried and proven successful plan that has been in operation since 1993, which is right at 29 years of success. I can only see is a federal takeover on the horizon, as there's only 7 years left. I would like to offer you some advice or a question that Dr. Martin Luther King asked us the night before he was killed. And he asked us as members of SNCC, and I ask you as the legislature, if not you, then who? If not now, then when? If we want to continue to kick the can down the road and not address the problem, eventually a legislature and a governor is going to have to take this issue on. It is better now than better to be late. I respectfully ask that you seriously consider creating a system-wide plan by law. Thank you, and y'all have a God-blessed day.
Thank you, Mr. Bennett.
Okay.
We have your comments and we hear your recommendations. Thank you very much. Public comments are still open.
today just following around. It ain't nobody got no real plan.
Good morning. My name is Christian Wei from UConn International University. I'm the president of this university. We established our university since 1999. And after 20 some years, we have developed certain kind of program for our people and also international students. But we want to do more for the CMI young people today. And therefore, we ask you to consider the Senate Bill of 2022-08. This is talking about UConn International University to obtain the Title IV, because without the commissions to the CMI government to establish the commissioner, and it will be jeopardize the university to get a Title IV for the student grant. Now, this is very important because a lot of young people of CMI, they went out for the islands to pursue higher degree. We only have a MNC today in our island and to provide the higher education. But UConn International University will be able to assist this possibility to provide more education possibility and the opportunity for the local CMI young people. Today, there's a lot of parents very feel agony because they have to send their children to the board or to the mainline to have a higher education. But we actually can do it here. UConn International University has already established a bachelor degree, and we actually obtained a master's degree. We do have a plan to start the doctorate level degrees to provide the needs of the local students. And but by establishing those kind of major, the problem is that the local students may not be able to afford it. However, if we our university being passed with this kind of Title IV, and then we'll be able to provide government grant, which is a grant they don't have to pay back. This is not a loan. If that's happening, that every student who is qualified will get about probably $6,500 per year. Now that's exactly the tuition, and probably they will get more than the tuition that they get, and so they can stay in the island to establish their higher education with a bachelor degree and master degree, even in the future, doctorate degree. Now, we do have a plan to start a university towns project, which means that we will be able to provide students graduate from our school to get the job here. And we have different projects that to cooperate with the Taiwanese university to establish certain kind of a sea urchin and sea grape project. So the students will be able to stay here and develop their career and then continue to provide needs for the island. So we're going to create a project that probably will reach out to 30 million profit with this kind of a university town project. We desire to bring the investor to the island, and but we provide with a higher education and also the investments opportunity, and therefore the local students will be profitable here. And so that's our desire, and humbly ask the Congress and the legislators to consider. And sometimes people will ask, but how about the islands like Rota and Tinian? And we do have a solution for that, because already been passed by the USDE, U.S. Department of Education, to offer online program. So not only that we are accredited, but we can also provide online program accredited. So for those students in Rota or Tinian, they don't need to go either, because they can also apply for the online program to get not only bachelor degree, but also a master's degree. So we are very excited and definitely very grateful for your consideration for this bill to be passed so that we'll be able to apply for the Title IV for our students. And thank you so much.
Thank you, Dr. Wei. Public comments are still open. Any other public comments? All right, I believe that there are no other members of the public who would like to give public comments, so we will close that part of our agenda and we will move on. I do want to let everyone know that PSS was supposed to attend our meeting this morning, but I received a call from them yesterday asking if they can reschedule. Part of the reason was that what updates they were going to give were relating to the Hopwood feasibility study and the Hopwood rebuild. They met with their CIP office the day prior, and CIP office of PSS would like the PSS to conduct public hearings on the matter, and they would like to respectfully ask to come to the legislature after they have conducted their public hearings. And so we did agree to that. They did send me some information that I have yet to review, which I will look at during a recess about the Canatabla bus service. And so that if you are watching online for that particular topic, I will come back to that later in the agenda. For now, if it's okay with everyone, I'd like to move on to older business. NMTI will be here next Wednesday.
No objection.
Okay, thank you. So I wanted to start our discussion with any of the three bills here that are part of our previous agenda. And if it's all right, I'd like to start with the third one, the Youth Congress Bill for an Act to mandate that all PSS schools provide free of charge to students meaningful hygiene products and for other purposes. I did give you guys a copy of PSS comments, which they shared just this morning. And so I want to call for a quick recess for you to be able to review that, and we'll start our discussion in about 5 minutes. So quick recess. Oops, and we are back. Thank you for giving us a few minutes to review the comments that came in this morning. So I'm just going to give a little bit of background on this bill. It was passed by the Youth Congress, and it is authored by their speaker, Senator Cielo Long. And it is titled, "This Act shall be known as the Sinamay Menstrual Hygiene Access Act of 2001." Part of the reason behind this bill is based on the fact that there are a lot of additional costs to, I guess, there are a lot of additional costs that women have to incur based on just their gender, and this kind of additional burden can sometimes be really stressful, especially for young people who are in schools that might not have resources. And so that was part of the impetus. And then I did a little bit more research on the topic and found that there are a lot of places in the world who already provide this type of service. And you know what was really interesting to me is that it's where I found that countries have been doing this even as far back as 2015, and the countries that are doing this are really kind of, it really stood out to me. Like Botswana has been providing free menstrual products to its citizens since 2015, or in 2018 Kenya, South Africa, they've been providing menstrual products to their women in schools since 2018. In the most recent years, in 2020, France, Australia, and Scotland have also been providing menstrual products to their citizens. And in 2021, New Zealand, England, and Wales, and even Prince Edward Island in Canada have also taken this stance. And so it's not something that's unique to the Marianas. It's actually something that has been a movement across the world. In particular, in America, there are 5 states who mandate that these products be in public schools and other public places. Their law does, change depending on the state, but it does include other public places that young people are at. And so there is precedence on the fact that this is happening. Other states that may not provide the actual products, there are 13 states that do not tax menstrual products. So I'm not really sure how we tax it here, but that's definitely something to look at. And the CARES Act this year also includes menstrual products as a qualified medical expense if you have like a health savings account or other type of insurance, which I know we probably don't have out here. But the fact that there has been a lot of attention and support to providing young people with access to menstrual hygiene products free of charge to help with those who might not be able to afford it, but also to reduce the stigma of needing it. And so that's a little bit of information that I found while learning more about this bill. So today I just want to bring out the discussion on what we think we can do. Perhaps there are more comments that we could solicit from the community. And so I just want to open the discussion to the members. Recognize Rep. Denita Yangtamay.
Because I'm a female. No, I just want to share that when I was a teacher for a long time, I receive a lot of students, females coming over asking me for those. So yes, I really think we need those in the schools. And about fees, I don't know. It's up to you, Mo. Okay, thank you.
Thank you, Rep. Yangtamay. Any other comments? Recognize Vice Chair Dabauta.
Thank you, Chairwoman. Thanks for the background, and thank you, Rep. Denita, for sharing your experience as a teacher. I really want to commend the Youth Congress and Senator Long for championing this effort and this issue. Period poverty is not something that we discuss here in the CNMI, really. And it's something I think many members of our community don't understand or don't have language for, right? So the lack of access to sanitary products is a great way for the Youth Congress to voice their concerns. So I'm really proud of them for bringing this to our attention. And I'm thankful that PSS provided comments. They did have great questions. This is something that I do support. If the committee would like to continue conversation, then we can invite PSS and the Bureau of Environmental Health, as well as it looks like they will be the enforcement agency in this bill. So that might be helpful for further discussion. But I think what a great time to bring this issue to light during Women's Month in the CNMI. And so I'm very grateful to Senator Long. Thank you, Chairwoman, for providing the context about period poverty around the world and what other nations are doing. When I was in Scotland, I did visit a women's restroom that had free sanitary products available by the sink. And to be completely honest, it really felt like this level of support that wasn't really there, in my experience ever. And so I see the impact it'll have on our youth, and I think that it can only be positive. So thank you.
Thank you, Rep. Babauta. It's interesting that you mentioned your Scotland experience, because in all of the data, Scotland is the first to really take it to that level of to provide it across the whole country. And so it's cool that you were able to witness that for yourself. All right. So I heard you say that we should possibly invite BEH, PSS, and any other comments that we might want to solicit from the community, maybe the author of the bill too. Yes, recognize Rep. Manglonia.
Thank you, Chair. I think we can also reach out to Youth Congress to have them. I mean, one of the concerns that was brought up was gathering data, and so they can, get a survey started with their constituents in the school. Then we can see how much of a need this is, or how much students will avail of these sanitary products. But also, moving forward, if this is something that the committee is going to heavily consider in drafting the legislation, one thing that we can also include is businesses maybe can donate sanitary products as a maybe a credit towards their ETC, as a donation to the school, to offset any ETC donations that they plan to give for the year. These are some of the instances that can help strengthen this bill, should it be drafted in the House. And so that's some of the things to consider. Thank you.
Thank you, Rep. Manglonia. That's a great idea. And I think that would partially address some of the concerns PSS had with the additional cost. Recognize Rep. Yumel.
And also to request from PSS the monthly absences of girls that would have to leave early and miss, because it happens frequently, monthly. So they'll come to school maybe not prepared, not expecting it today, and then how many of them would have to leave? So that's absences may count too. So we need to see how many of them get excused, for accidents or on the days that are not supposed to get it and they get it. So that's something we need to ask PSS, as it affects the attendance in school. So it's something also to look at. With that, I have no issues with the bill. I think it is a policy call with us. Rep. Donald had good comments with regards to tax credit in the businesses. That's something we can change with the bill. So with that, I'm ready.
Thank you, Rep. Yumel. And that to your point, that is one of the things that is referenced in their findings and purposes. Attendance sometimes is affected, but I think what PSS and even I, when I was reading through the bill, I wanted to know more specifically what is the data. I'd like to see what the actual numbers are, just to help with that justification. And then if I could add one more thing to possibly get for this is maybe a financial fiscal analysis on what the additional cost might be. So at least on an estimate to see how much more of this would be part of, well, how much more of this would would PSS have to spend, and just to keep that in mind, the ratio. All right. Any other discussion topics for this bill? Ready? Okay. So just to recap what I will be preparing for our future meeting, I will be collecting comments from BEH, PSS, and the Youth Congress author, and possibly the body. Should I invite any of them specifically so we can have interaction? Maybe. Okay. So maybe I'll do that with the Youth Congress in particular. Okay. And we will put all these other things that you've shared into consideration. Thank you. So we will move on. Thank you, everyone. If we can now go to number 2 in old business for Senate Bill 22-05 SS1 to establish a behavioral health professional scholarship and for other purposes. I'd like us to discuss that bill and share any amendments that we'd like to work towards. Discussion open. I recognize Vice Chair Babauta.
Thank you, Chairwoman. I remember that during our discussions at our last meeting, we wanted to reach out to the scholarship office and see if a bill, if legislation was necessary in order to establish a new type of scholarship. Did we hear back from the scholarship office?
Yes. Thank you, Vice Chair. Yes, we did hear back from the scholarship office, and what they told us was that the funds that are budgeted to them on the annual basis are already dedicated to students in the programs that they have, and so they would not be inclined to start a new scholarship unless there was a funding source behind it, and or were mandated through a bill like this. And so yes, they can technically, but because of the amount of funding that they have, they do not want to take funding away from anybody. So unless it was done in this manner, they probably would not pursue it. So yeah.
Noted. Thank you, Chair. I yield at this time.
I did, based on your question though, I did get a financial analysis from our fiscal analyst. And TG I did share that with you. I'm digging for it now. Here we go. So I asked him for 2 figures. One figure would be just what the bill says, because one of the things that I have been taking time to try and figure out, which I have a solution for now, but before we had meetings, trying to see how much would this cost per year, and then knowing that some master's degree programs do not offer licensure that is concurrent. So once you graduate with your behavioral health degree, one of the steps you have to take is to get licensed. In order to get licensed, you have to be an intern or be in be part of a clinical supervision process, which often is an unpaid internship, and it can sometimes take up to 3 years. And so I asked TG to provide us 2 analysis. One of, if you get the scholarship for the 2 years, how much would it cost if we did 5 students a year, 10 grand a year? What does that cost? And then what if we considered amending the bill to provide additional scholarship for the years that they were also getting their licensure? Because the intent of the bill is to make sure that we have licensed professionals back in the Marianas. But if we don't make sure that we carve out that time for them to become licensed, we won't get what this intent is. So, and the programs are different depending on the college. So some schools provide licensure that's concurrent, some schools do not. And so I just wanted to see what the numbers were. In his analysis, if we were to just give a scholarship for the 2 years going to school, with 5 students per year at $10,000 per year, the number that we would need to make sure that we are budgeting by the end of the last year would be up to $750,000. So the first year will cost 50 grand. The second year, because you have your first set of students, and then your next set would be 100 grand, and so on. For if we were to extend the scholarship beyond their graduation, but to include the time that they're doing their unpaid internship for licensure, the cost would rise quite much more in the third year, because in the third year they would have people receiving the scholarship and also be part of the internship, right? So we would need, by the end of the whole process, $1 million. And I guess seeing the numbers, it made me think about how we could possibly amend the bill to provide that flexibility for licensure time, but also maybe not take on all of the responsibility of the funding during that, because we are, not really sure what the economic outlook is, and I hesitate to obligate the Marianas to something if we're not really sure there. But that's just my thoughts. Any comments? Recognize Rep. Manglonia.
Thank you, Chair. I think what we need to get from the CNMI Scholarship Office is data on the honor scholarship program that they implemented a while back, where recipients would have to come back and serve a specific amount of time for each, I don't know if it's semester or year they receive the aid, to see how much of these students are in default and whether they've been successful in getting back some of these funds. And this is something that might be of concern should we move forward with this particular scholarship, because from what I gather, if this recipient receives the scholarship for the 2 years they're in graduate school, or you're talking about having to give 8 years of their time here in the CNMI, and I don't think it's clear if a student or if a graduate were to come here and only serve, say, 6 out of the 8, will their scholarship be prorated in terms of how much they have to pay back? Another way to go about this is, rather than provide the scholarship, maybe give an incentive to those that have already graduated to move to the CNMI or come back to the CNMI, and whether it be in a form of a salary increase or some kind of a incentive or bonus, that a signing bonus for any individuals that would like to come and serve here. But I think the important part is to also, like you mentioned, Chair, earlier, about having this possibly being an obligation, or putting the CNMI in this obligation where we can't guarantee their return and to give back. And even if they do get the degree in these fields, will there be positions open? And that's another thing to consider. But one thing that we can get from the CNMI scholarship first is to see how the honor scholarship program worked in terms of students coming back versus those who went into default and have to pay that back, and are they paying it back? Thank you.
Lots of great comments there, Rep. Manglonia. I can say that I did ask the scholarship office about their default rate, and the rate of default is about 19% of those that have not returned home. And if you think of that with our number of 5 students, that means we might get 4 out of 5 that would return home because of the general possibilities. But what you said about the sign-in bonus and those things are definitely other comments that I've received too. So thank you. Good ideas. Other comments or thoughts? I did also include in my questions of, is that 4 years per year of scholarship a reasonable one? I think that's definitely something to look into. Sorry, just making a note. Okay. How would you guys like to proceed? I do have some amendments that I'd like to consider if we were that kind of address a few things as far as the uh, the licensure timeline, because I guess for me that's been the biggest holdback for this bill is um, how to make sure we honor like when you graduate doesn't mean you're actually going to have a license, and so making sure that that's written in some way. Is it okay that we if I offer some amendments for that particular topic while we still gather that information that you mentioned? Is that okay? Yes, no objection. Okay, so Cam, I'm going to begin. I'm going to offer amendment for starting on page 3, line 19. This was a amendment that was recommended by PSS in particular, because there are programs that are online and we would like to make sure we recognize that. So for line 19, number 4, please add after agree to, remain in or. So the sentence would read, agree to remain in or return to the CNMI after graduation. If you could add and licensure after graduation. Remain in or return to the CNMI after graduation, and licensure. Add and licensure after graduation. Delete from college, and instead of the word and, put the word to. So the sentence should read, agree to remain in or return to the CNMI after graduation and licensure to work as blah, blah, blah. To work. Work is already there. Gotcha? Oh, there you are. Okay. Yes, strike out from college and those 3 words.
Want to chime in?
Can I answer that? Okay. So the question Rep. Manglonia posed was, will people be able to also work in the nonprofits? And it does say that if there are no open positions within the government, that they may open their own private clinic or work in a private clinic. I have reached out to different clinics to get comment on, and I'm also part of the Blue Ribbon Consortium, which is really trying to also increase the number of behavioral health specialists in the Marianas, and it's part of their goal as well. So this bill would really assist in that group's missions to provide more access to behavior specialists in the Marianas. So the answer is yes. Okay.
Yeah.
Maybe can you find where you would like to put that in the language while I move on to the next amendment here, and then we'll add that in for the next one. Okay. Cam, we're gonna jump to page 4, and I'm going to ask that we move line 16, instead of it being A, I'd like it to be B. I'd like to add an A above it. And this is where I think the most substantial change will be. You ready? Awesome, thank you. All right, here it is. If recipients enroll in a behavioral health program that does not provide concurrent clinical supervision and licensure, does not provide concurrent clinical supervision and licensure, comma, they shall have up to 3 years immediately post graduation to become certified in a behavioral health field. Provided, sorry, I'm not done. I was looking at my lines too. Yeah, you delete the period maybe. Provided the recipient shall do the following, colon. Do the following, colon. One, you go ahead and tab in one or whichever. Provide the scholarship office a copy of the contract or agreement. Provide the CNMI scholarship office a copy of the contract or agreement between the scholarship recipient and the clinical supervisor. Period. And number 2, submit a certified copy of clinical supervision activity to the scholarship office on a quarterly basis. If you need to add CNMI, that's fine, quarterly basis. Do you want to put CNMI in front of it just for, thank you. Okay. So that is the amendment that I propose to address the time that's needed to receive their licensure in case it is not a concurrent degree program. It doesn't obligate us to providing scholarship during those years of licensure, getting their licensure, but it just allows them so that if you graduate, you don't have to pay back right away if you actually aren't licensed. Does that make sense? Legal counsel, is that okay in substance?
Everyone's gonna have different policy issues. It's not a bad start.
Okay. Is there any
I would recommend now that we have a stationary target that we give it to the stakeholders and they can put in their 2 cents.
thank you. So it sounds like I should get this bill and send it out for comment a second time to all the parties that I first sent it to.
With the caveat that if they don't respond to this particular language, then that would indicate that they're in favor of it.
Gotcha.
If they have any objections, they should raise it, otherwise they'll be deemed to be
Okay.
on board.
Thank you.
That express part.
Gotcha. Thank you. All right, so I will work on that for the next meeting. Are there any other amendments that would be like to offered? Rep. Manglonia?
Well, before we adopt your amendments, I was thinking to
Hello, my bad.
just add it into that section, the first amendment, just to include it as one amendment. Page 3 was it? Maybe towards 26. The individual may work at a private clinic or may work at a non-profit or not NGO.
Recognize Vice Chair.
Thank you, Chair. I completely support this amendment of granting more flexibility to the graduate. I had a question because you are involved with the Blue Ribbon Coalition.
Yeah.
Is there a reason why we want to have the graduates focus on government-related jobs? Is there a difference with having the graduate come back and apply for first CHCC and then government agency and then expand, flexibility thereafter? Or can we just appreciate them being back here, serving in any capacity? So I wonder if at the Blue Ribbon, they speak of having the licensed professionals in certain parts of our community, if that really does make a difference. Otherwise, for this section, I
Yeah, so like towards the end.
would propose removing the requirements, and number 4 being simplified to
At
agree
any entity within the CNMI.
or just to agree to return to the CNMI after graduation from college and work as a behavioral health professional. Scratch everything, go down to line 28 for a period of
4 year.
4 years and even 4 years seems a little excessive in my opinion. I think for 1 year of scholarship to serve for 4 years, that's pretty excessive.
Yeah, the honor scholarship was 1-to-1, I think.
Yeah, I think 1-to-1 or 1-to-2, that would be more reasonable in my opinion, because it's not, we love this place, but it's also a reality that there are opportunities everywhere else in the world. And, here we still are working to progress our economy and, other areas of quality of life. So.
Okay. So maybe go ahead, Rep. Yanktamai. Did you want to add to that? Go ahead.
Because like she said, there are other opportunities somewhere, but is there a way for us to get money from them while they're working elsewhere? I don't know.
If they choose not to return, then they have to pay back. So if it's 10,000 a year, then they have to pay back the 10,000.
But the goal really is to encourage, right, our graduates to return home. And if the opportunity to receive 3 times the pay elsewhere in another city, and them being able to pay back the scholarship as a loan becomes an option, that really defeats the purpose of this legislation, right, in my opinion. So I think granting flexibility is important. Reasonable years of commitment, that's important. So that it does, so it does look like a reasonable requirement to fulfill after graduation.
I fully agree. I'm just looking in the language where it has those things multiple times. So, Cam, are you ready? We're going to add more to this amendment. We're going to start with page 2 because it does mention the years of commitment in page 2 as well, starting on line 15. So go ahead and strike out at the Commonwealth Healthcare Corporation all the way down to, sorry,
Maybe we can take a look.
okay.
You can scan the document for.
Okay, so from work all the way to line 17 of, and put the word as instead. Just delete that and add the word as. We're gonna go to 2 years instead. But so yeah, go ahead and strike that out all the way to the first part of line 17. Yeah, strike through. Okay, add, and then add the word underline and or as. Line, oh, it moved. Okay. As, okay. So in exchange, the scholarship recipient must return to the Commonwealth and, oh, can you keep the word work? There we go. Work as a behavioral health professional for a period of, and then take out 4, put 2. 2, we're agreeing on 2, guys? 2 is reasonable? 2 to 1. Usually this degree is a 2-year degree, so max they would be required is 4 years. 4 years is reasonable. Okay, scholar Friday, and then shall we just delete that whole part? Because if it doesn't matter where they work, as long as they are working here, then that part provided can just be deleted all the way up to CNMI scholarship. Yes, yes, Rep Babata.
Another thing to keep in mind is, in the health committee, we just recently discussed the SIPAC bill.
Yes.
So will the students need to be in the CNMI physically?
Oh, good question.
Because they may be able to provide services to our people virtually,
Ooh,
right?
I like that idea.
So how will we,
How can we include that?
address that? Yeah.
Well, okay. We can change the language. Must be employed by an entity in the Commonwealth and work as a behavioral health subject. If they're online, 14 must.
Do we want to grant that flexibility?
I don't know.
In my experience, virtual services work just as well. So I don't know if the committee wants to talk about, like, what if this graduate applies to serve the Commonwealth community but is not here physically?
Just like being at Washington DC or something.
Right.
The Kililis office, they have their own office over there. And then they just
They have clients who are here from the community and they schedule their, appointments online, virtually, which is convenient.
It's a definitely new field of medical access that is something that we are still, it's like the beginnings of that. It would be nice to provide flexibility for that as well. What are your thoughts?
I don't recall on the SIPAC bill if those,
No, but so the side fact is one thing, but for
Yeah.
that person to engage in those online thing, they would need to establish a business here in the CMI and then do their services from wherever in order to be considered for in terms
For
of
this.
repaying back.
the scholarship.
Go ahead, legal.
Yeah, on a personal
Short recess. And we're back. Thank you for your patience. We were just adding the language that we're discussing for this amendment. Are we ready? Okay. So what basically that we did is to remove the language that kind of focuses on government healthcare openings only, and that allowing a recipient to return home and work in any job opening available. And we also changed the requirement of 4 years for each year of scholarship to 2 years. And that part was repeated a couple of times, so we're just fixing it wherever it is in the bill. And when we're ready, Cam will tell us, and we will add a couple more amendments. Ready? All right. So I think we also wanted to, in conditions, because the lines are out of order already, I apologize. I can't tell you what line it is, but in the conditions of scholarship award, we wanted to delete the entirety of, I guess it would be section C now, and section D. Yes. We don't want to limit anyone to only this scholarship. If they can avail of any other scholarship by if they are eligible, we shouldn't block them, because a behavioral health degree costs way more than 10 grand. So I don't think we should limit them, especially if you're going to be taking an unpaid internship for 3 years. We should provide as much support as possible and not limit. So that's why we want to get rid of the B that became C. And why we want to get rid of D is that currently there are many programs that do offer online degrees, and if we can keep our kids and people home so they don't have to fly and go so far away, then it will be easier for them to stay home to work in that field. And so that is why we want to also delete part C or D, whichever number it became. And just to clarify, it is already a requirement in the criteria that a recipient of this scholarship must be from a U.S. accredited college or university. So that is addressed. Moving on, we wanted to consider changing the word may to shall on section 1624 for program administration, that the CNMI Scholarship Office shall promulgate rules and regulations to effectively implement this article. We want to make sure that it's clear. Thank you, Rep. Balta, for that. And then if we can go back to the conditions of the scholarship award, I'm sorry, we're jumping around. We do want to add a new letter, so maybe it will be C. Oh, cool. And this one will address the business license requirement. So how shall we start that language? Rep. Manglonia, can you share again what you had said? I kind of blanked out a little bit on how we should write about the business license. Oh, here, I remember now. If a recipient chooses to provide telehealth services, they shall apply for, or give me another word, for obtain, thank you, obtain a business license in the Marianas, in the CNMI. I don't know if that's sufficient, but let's talk about it a little bit. Legal, do you have any other recommendations to make this clear?
Yes. About
Maybe if a recipient does not come home, or if a recipient does not come home post licensure and chooses to provide telehealth, or should we just leave it?
I think that's pretty clear. to me.
I would just copy the format. Behavioral health services scholarship, like the recipients of the behavioral health professional scholarship
Okay,
shall obtain a business license if they opt to practice outside the CMI.
okay. Got that, Cam? Getting there.
Grab that, copy it.
When you're done, Ken, you went to the license form.
Yeah,
Shall obtain a business license in the CNMI.
if they choose to, practice. What is it called? Telehealth medicine?
Yes. Yep, perfect. Rep. Englunia, you are going to say?
We went to the, what's the requirement of the certification licensure? Is there a requirement that they have to be certified and licensed?
Yes. Well, I mean,
So just to be
yes.
careful, right?
Yeah.
Because if they're practicing telehealth medicine, that presumes that they're licensed or allowed to practice in their home state, right?
Yes.
Okay.
That's part of, I think, what the SciPact is also doing is allowing for people who are licensed in California to also practice whoever the partner is.
I think one of the behavioral health fields is not limited to psychology, public health. What's the certification of public health?
What is the certification? That's the thing, like they're all so different, and that's why like having that flexibility to give that time, because depending on the degree field you do go in, some might be longer than others. So the
Some of these positions, they wouldn't necessarily require certification or license.
I believe all of them do for those particular ones, and like the requirements might be different, and some things might be offered here and some might not. It just depends on your degree plan, I think. If you want to put your mic on so the rest of the world can hear you, it'd be great. Thanks.
So they can come back. Their clock starts when they're employed or obtain a business. Well,
Oh, yeah, good question. We need to put that.
when they are employed, and then they'll have at least up to 3 years. If I'm understanding it right, they have up to 3 years to obtain a certificate or license.
That is kind of the average number that I garnered from all of the input that I received, because even that, it depends on the program. 3 is kind of the average max.
Okay, so no, I'm just So there's a 3-year grace period for recipients to obtain some kind of, okay.
Yes, but in that grace period, you have to be actively pursuing it. And by knowing that you're actively pursuing it, you're submitting a certified copy of your clinical activity and commitment with your supervisor, and you're providing your scholarship, providing the scholarship hours, providing the scholarship office with the supervision activity, which would be your hours. So at least we know that you're not just, you're being active and pursuing it. That was what I wanted to try and add. I hope that is sufficient. But of course, this is what we'd get additional comments on from the people we already received comment for. And they might tell us less years possibly, or more, I'm not sure. Should we say something that a recipient shall be actively pursuing it all 3 years? I mean, is that language that we have to put in to clarify?
I want some sort of cap, right? Because in other programs, there's been some abuse where students will enroll in a program, get the scholarship money year after year after year, and not complete the degree program. The sole purpose of them being a participant
Is to
get the
finish.
degree.
Ah,
Yeah, so we should probably have some language to cap the benefit to a certain number of years or a certain amount of money.
oh, well, the 3 years does not include scholarship, the additional 3 years.
Right.
It's only, the scholarship is, that would only be if their program does not provide concurrent. Because there are programs that do provide concurrent, and the whole point is to be licensed. And so if it's a concurrent licensure, then you graduate with it and you're good to go. Whereas if you are not licensed, you are not good to go. You will not be able to be hired. You're going to have to get the hours some way.
And in the 3 years, they'll be receiving scholarship?
No,
scholarship? No.
That's not what this is supposed to intend, but I don't want to accidentally make that. So is that clear that there will be no scholarship during those 3 years, but we will not make you pay it back?
Not clear. Yeah, I think it's implicit, but it could be.
Sure. How can we make that more explicit?
Yeah, go down. More. Yeah, I think we can just put in a last one that says like recipients shall only receive like, 2 years or 3 years, was it 3 years max?
It says it's a 2-year degree
2 years or $20,000.
for up to 2 years for a master's degree is what the language is on page 3, line.
Because this program is just for this program.
So that would be on page 3, line 11.
Yeah, but let's say this program is done in 2 years and their dual graduate degree is 5 years. They're gonna get 5 years of this scholarship.
But the cap, in a sense, would be wanting or having to give 10 years of your service to the same time. You should get 5 years of scholarship.
I guess it's a policy call.
Amount.
But I'm saying if they get a dual degree that takes 5 years and this would have been just done after 2, why give them more money when they already completed it? Just because they have a dual degree that they're not done yet. But
I
policy-
think this
policy
covers
should-
it. That's clear.
Yeah.
B.
Which one do not allow it? Shall be 10,000 per annum for students. I think
In regards to the limitation language,
it just says 10,000 per year, but it doesn't say how many years.
It does for a period of up to 2 years.
For a period of up to 2 years for a master's Okay. I stand corrected.
And then back to the,
2 years for master's degree. Okay, all right.
and then back to the other one you were talking about?
There's the first 3 years, right? 3A.
Oh yeah, this is already masters.
Yeah, this is for masters.
This is only for masters, the scholarship. If we go back up to being clear for the 3 years. Here, if we're
So we just put a sentence that says, oh, because that's one sentence. Can you continue on after number 2? Like just as I'm asking, we don't have to do it yet, but maybe we could put it there, that no scholarship award shall be given during the licensure timeline. I mean, that's just to make it clear, because the language in the beginning of the bill talks about it's a shall receive up to 2 years. So this one just clarifies that there is no scholarship during the 3 years of licensure, just to,
Post-graduation.
Yeah.
Post-graduation licensure, obtaining time, whatever.
so would you be able to just write right there where Cam's thing is? Can you just write,
This is number 3.
I don't know, is it a 3?
No,
I think it's just the rest of the sentence of part A.
okay.
And so,
Can I see the whole A, please?
sure.
If the recipients enroll, it doesn't provide the shall 3 years. Right, okay, so.
No scholarship shall be provided during the 3-year licensure, something like that. Yeah.
Okay, okay.
Yeah, just a new sentence right there. But how should we say that sentence?
During this post-graduation period.
Thank you, Cam. No scholarship shall be, or the recipient shall not receive scholarship,
Yeah.
or is not entitled to scholarship,
Put it that way.
is not entitled, or shall not receive. Okay.
Or be entitled to.
Shall not receive
scholarship award.
scholarship award. Yeah. And so, in a sense, this just encourages people to find programs that provide that concurrent licensure if possible. Okay,
Sorry, just to,
sure.
do we need to clarify it that it's shall not receive additional scholarship award? Like it's
Under
this.
program?
This scholarship,
Yes.
award under this program.
Scholarship under this specific scholarship.
Under this program.
And maybe delete the S at awards.
And recipients.
The recipient shall, yeah, there we go. Additional scholarship award under this program. Okay. I think that definitely is very clear.
I have 2.
All right, we got 2 more.
questions.
2 questions. Go ahead.
My first is it clear that if we have students enrolled now, will they be able to avail? Do
Oh,
they need to be newly accepted to the program?
it doesn't say that.
It says up to 2 years, but what if they're in their, like, they've already completed their first year and they want to receive 10,000 for the second year?
I think that
Per annual, so they have to be
So that would be okay, right? In the language here?
I think it, yeah, because it's, they would have to apply every year, and as long as it's not more than 2 years, then you should be able to get 1 year.
Okay, sounds good. And then page 5 under sunset. So there is a sunset provision
Yes, thank you.
for 5 years. So this program will expire after 5 years. Is that sufficient? I just wanted to like bring that up.
I'm glad you mentioned that. I did think about that with respect to the recidivism rate that the scholarship office shared. And so, you know, if it's about a 19% rate, we can expect maybe 4 graduates per year on the high end. And so 4 times 5 is 20. Is 20 enough? When I asked PSS, you know, and when I spoke to the Blue Ribbon Consortium, I think they would like more than just the 20. Uh, so that's definitely something to consider. But I guess it could also be amended in a future year or two if they see that there's more need and that we wouldn't want to sunset it. We could also change that. Any thoughts on it?
You know, I have a slight question on the sunset though for them.
Okay.
Like if you're in the 5-year year,
Yeah.
Someone shouldn't assume that if they get the first year, they're gonna get the second year too, because they might be in year 5 or their first year.
Well, I did have, so I don't know if we have to include language to make sure that they do, because if you start a program, you should be able to finish it if it's up to 2 years. So in the math that he did for me, for people who begin in year 5, he still accounted for that cost even beyond year 5, because in a sense, it's like an obligation. So in the numbers that he gave me, it did include beyond year 5 for those who were continuing on.
Technically, it's in year 6, right?
But you wouldn't take on new students.
Yeah, so he should, I don't know who he is. But
Yeah.
the other way around would be to stop in year 3, accepting people, because
Year 4.
Sorry, year 4, accepting people, because you know that in year 4 you can finish 4 and 5 and be done, and that's not unfair. Whereas if someone qualified in year 5 and you just tell them, by the way, we can finish half the program and then the other half's on you, that might cause some automatic forfeiture, or if we set them up for failure.
I also wonder if there are sunset provisions on the other
I think,
scholarship awards.
This looks like a very similar format.
The honor scholarship for
And if there isn't, they should be. We don't have permanent funding. So
Yeah.
we could go the other way around, right? Where like new recipients shall not be named in year 5. of this
Okay.
program.
So we can add that in as an amendment. Where would it be best?
Sunset?
At the sunset?
Oh.
Maybe not in the sunset, but we could put in view of the 5-year program, only recipients, new recipients shall be, awarded the scholarship only in years 1, 2, 3, and 4, something like that.
Okay.
So we can
So
put that
it's
as the
really like
conditions.
a
In
window.
conditions? Yeah, it's a window.
Yeah.
Yeah. So okay, let's put that in conditions.
Make that a D.
D or C? Oh, D. And then legal, if you don't mind reading it, using the mic and saying it.
The recipients of the behavioral professional scholarship under this article shall be approved and awarded scholarships only in the first 4 years of this program. In view of the 5-year sunset clause. Yeah.
Good point.
Year 5 shall be
for ongoing enrollment or something.
This shot shall be approved and a large function only in the first 4 years of the program. You want it the year 5, right? No.
It will cost the CNMI less money to do it this way too. That's 50 grand less. Actually, 100 grand less because it would be 2 years.
Shall be approved only in the first 4 years of this program. That sounds good.
Yeah.
That was good.
Wee-hee.
It's almost like a call.
Yeah.
Like a call out for, yeah.
I have a few people who I'm thinking of that would have liked to have done this. I wonder if they're still interested.
My 2 interns.
Both of them?
Yeah,
Cool.
They just got accepted into their master's program.
Oh, I'm so happy to hear that. Oh my gosh.
Yeah. So they're gonna leave to Alaska.
Wow.
Yeah.
Okay, so we've got lots of amendments in this bill. And I think that one definitely addresses the 5-year sunset to make sure that we stay within our means. And that additional amendment actually does cut the cost for the CNMI government by $100,000 by the end of this program. So good job. Okay, any other comments or amendments that we can add before we try to adopt these ones? Comment, yes.
I just have a comment. After, all of the amendments and the discussion, it really does look like this bill is going to be a call out to our community, to our students, to focus on behavioral health. And it will really show that the leadership in the CNMI is committed to the mental health and well-being of our community. The 2 interns with my office, Emma Latilamar and Trini Iguel, are current students, and they have been accepted into their master's program under social work. And so this is definitely a scholarship that would benefit their studies and encourage them to come home. So it's really cool to see how the work that we're doing here today will impact our communities so closely in our circles. And so this is good work. Thank you, committee.
Thank you, Rep. Babata. It's always nice to hear, especially what Kagman High alumni are doing. Woot woot. All right. With that, can I get a motion to adopt these amendments? A second over there. All right. It's been motioned. It's been seconded. Legal, do we do voice vote for this or? Okay. All those in favor say aye. All those opposed say nay. And these amendments have been adopted. Yay. Congratulations. So next steps, I will take these amendments and get the comments from all of the agencies that had it before and any of the new ones that we discussed earlier. Any last things to share? Recognize Vice Chair?
Chair, will we be providing a deadline? We'll be giving the agencies a deadline to comment?
Yes. Any recommendations on that deadline?
10 days from when you.
Okay.
Yeah, 10 calendar days.
Okay. I will make sure that's part of my letter. I anticipate we will have another meeting next month to finally dispose of this one if we get all the comments and have any other changes. So with that, I will move on. It is almost lunch now, and so I would like to I would like to adjourn our meeting today, and we'll keep these other items on the agenda. We are meeting again on Wednesday, which I will be sending out the announcement to. And so we will address the remaining things on our agenda on Wednesday, same time. Any questions? Yes, Rep. Manglonia. Microphone, please. Oh, yes, I will go to miscellaneous next. Okay, now we're on miscellaneous. Go ahead.
Thank you, Madam Chair. So unfortunately, I will not be here for the Wednesday meeting. However, the one thing that I wanted to bring up, and I was hoping if PSS had shown, it was something I would have brought up. I've been getting numerous inquiries in regards to the premium pay for PSS employees. I know we've heard from Secretary of Finance that they have not received the request from PSS, and that you, Chair, have heard from PSS that they did make the request. I just wanted to find out what the status is with that, and if they didn't have anything in black and white, that's something that the committee can request PSS to provide the committee any formal request that they make to the administration requesting for premium pay. From my understanding, at least on Rhoda, the pupil transportation and several other personnel are tasked to sanitize, our classrooms and buses and all these um, rooms, and so they are however people may see it, they are essentially frontliners because they deal with students not knowing who may have it or not. And this is something that they can. People have been saying that they did receive some kind of bonus, but that's something that's totally different from what others have received, and that's it's one thing to get the incentive pay or retention pay, but it's another to face this pandemic head on. And so I believe and I feel that these school personnel should be eligible to receive the premium pay as well. And so, if that's something that the chair and the rest of the members who will be here on Wednesday can bring up to the commissioner and his team to try to push forward and provide a committee, even with the Ways and Means Committee, copies of their communications with the administration so that we can assist in trying to get this assistance to them. Thank you.
Thank you, Rep. Manglonia. And as chair of the Ways and Means, I would definitely make that request to share with the rest of the colleagues. And yes, what you said is true. There is a difference between the retention pay and the premium pay. Retention pay is specifically to retain people in the jobs that are hard to fill. And especially with PSS and all of the changes that have gone, it was a much needed infusion. Many people in PSS received salary reductions prior to the pandemic and have yet to be restated back to those levels. And so it's definitely an issue. I agree with you. Premium pay is something that they should definitely be receiving because of their role in our community and how important it is and how many people they interact with on a daily basis at all levels of the school, from the bus to the office to the classroom. So thank you for bringing that up. I fully agree and support, and I know that PSS will provide those things to emphasize. Any other miscellaneous comments, announcements? Yes, Rep. Sheila Babata.
Thank you,
Vice
Chair. I too will not be able to attend the meeting on the 23rd. I am speaking on a climate change panel for EPQ. And so I fully support the statement made by Rep. Manglonia. And I hope that at this meeting we can also bring up the workforce plan or working plan or issue that was in today's public comments made by Mr. Bennett. Thank you, Chair.
Thank you. Yes, when NMTI is here next Wednesday, they will share some things that are related to the workforce plans and the collaborations that have been going on between NMC, PSS, NMTI, and the Department of Labor. And so all of those will be shared on Wednesday. And I hope, Rep. Yangtimai, will you be here on Wednesday? Because okay, understood. 29th is zoning, no problem. Oh,
Yes.
same day?
That's the summit.
If that's the case, should I reschedule zoning so that, yeah, I'll look into that. I can do that. It's still advance notice. No problem. Okay, so I hope that Rep Yuma will be here so we can have quorum on Wednesday. With that said, can I get a motion to adjourn? And seconded, all right. All those in favor of all those in favor of adjourning, say aye.
Hi.
All those who disagree, say nay. You can stay. The ayes have it, and this meeting is adjourned.
Awesome. Thank you. Good work today.
Great work,
everybody.
guys.